you know, I think, uh, I hope this is aligned with what'll be useful for you. Let me just say too that if anyone has questions, my current setup, I'm not sure how easy it would be for me to read questions posted in the chat box. So, just chime in, just speak up. I'm happy to talk this through. So I've been on Case Western faculty since 1988. My research is depression and suicide, conducted at the VA and conducted through the county coroner's office. I teach CBT, and I'm in charge of our training clinic on campus. And despite the academic responsibilities, I've always seen clients as part of my work. And the interest in the Socratic method goes back to graduate school, goes back to really early writings by Aaron Beck and Albert Ellis, where they would mention the Socratic method. Beck started mentioning guided discovery. No one really talked about it in a way that explained it, and I could find useful guidelines for what do you do, how do you accomplish this. So there really is very little research that directly supports the Socratic method. In my view, it's a clinical and theoretical integration, combining writings from ancient philosophy, the dialogues of Plato, and contemporary, primarily cognitive therapy, but cognitive behavioral therapy. So most of my work is really centered in CBT, probably with a bias for Aaron Beck and his contributions. So what I've done over the years is try to read, try to integrate, try to see what do I do with my clients? How do I teach therapy to the students at Case? And what do people want? And so we'll try to look at some of that. Let me see, why is this? So this is my full model, and it's evolved over the years. Really, the ancient dialogues and the philosophers, I've read a lot of philosophy that aligns with this, and the philosophical books are really hard to read to get a sense of what they're talking about, but I've tried to pull it out. So most people attribute systematic questioning as the core of the Socratic method. And then inductive reasoning. Philosophers attribute the start of inductive reasoning to Socrates and his discussions. Disavowal of knowledge, we'll come back to each of these, but disavowal of knowledge more and more, I think, is important. When I sit with a client, I don't want to see myself as a teacher. I don't want to see myself as an expert. I'm not here to solve my clients' problems and make their life better. I'm here to work with them and understand them, and together as a partner, explore ways they can make their life better. Guided discovery, we'll talk about that a little bit more. Really, I want to have a sense for where we can go, but I'm not going to ask questions that have a predetermined answer. I'm going to ask questions that get us both moving and thinking. And then brief sequences. If I do Socratic method, if I have a 50-minute session and 10 minutes, I feel really nailed the Socratic approach. I feel it was a good session. But if I do more than that, it starts to feel like an interrogation, and that's not good for a rapport. The content, so much of what I'm doing is trying to help clients look at their life struggles as a problem that can be solved. And again, we'll talk about that. Universal definitions is the third piece that's directly linked to Socrates and the ancient writings. Confronting terms. For Socrates, he was trying to force people to explain their use of terms like justice, wisdom, piety. What I find is we all use terms in a certain way, and some terms are misused. horrible, terrible, catastrophe are terms that are really emotionally loaded and oftentimes not really deserved based on the situation. Trauma and PTSD, I think, are misused, mislabeled. So try to clarify that we both are using the terms the same way. And then the last three, self-improvement, really that's my goal, is to try to help people figure out how they can improve their life and move in a better direction. Virtue ethics is probably the most controversial aspect, where sometimes I try to just help my clients be a good person, figure out what is a good act that you'll be proud of in months or years later, rather than just dealing with getting through your day. And then core beliefs. More and more I find core beliefs that I hold as a therapist end up guiding what I do and what I say to my clients. So that's a whole lot, and I'll try to go through some of that, probably not all of it. This is really where I start. So on the left side, we've got directive approaches, and I've seen CBT become weakened by an over-reliance on treatment manuals. Some of our graduate students really want the structure, want to be told beforehand what to do in each session, and you lose that collaborative approach. Or the older interpretive approaches, where we'll speculate and label for clients. And I think the therapist is treating the client instead of working with them. On the right side, more of the Rogerian, the supportive therapies, the kind words and helping clients feel better by the end of their session. And it always struck me when Albert Ellis really forced a big distinction. He basically said, I'm not trying to help my clients feel better. I'm trying to help them get better. And I think that has always stuck with me. So the Socratic approach tries to strike a balance where you're working closely, you're working really hard, but you're trying to get inside the client's mindset, the client's life experiences, and figuratively get behind the client and push them to think differently, do differently, behave in a different way, and see if it is an improvement. And a very much inductive, experimental approach. Let's try something different and see if it helps or not. Most of my clients are adult, often struggling with severe anxiety, depression, and suicide risk. Seen on an outpatient basis, usually once a week, sometimes more intensive if the problems are bad. And clients will always bring their questions into session with me. What should I do here? How should I handle this situation? Should I quit my job? Should I end this romance? Can I really trust this person? And it's easy to fall in a trap of directly answering those questions. But I think also it makes me rise above and be the expert, and I will tell you how to live your life. Personally, I'd like to do that with my kids, but with my clients, I try to avoid taking control of their life and telling them how they should live their life, what major decisions, what career path they should take, what romantic partner they should pursue. Now, we don't want to go the stereotypical way you might see in TV and movies. What should I do here? And the therapist just throws it back. What do you think you should do? I mean, that's not a useful answer. And I think it's very transparent that you're not really working with them. You're just throwing their own question back at them. So here's where, again, having a string of questions to help them start looking at various ways of confronting their situation and looking at it differently. Let me do one more slide, and then I'll pause and see how we're doing for questions. So some of the systematic questioning approach, early on in one of my first or second sessions with clients, when we finish, I will usually apologize and I will say, let me ask you if you have any questions for me. Quite honestly, I think I've asked you 60 to 70 questions in today's session. So let me turn it around and see if you have questions you want to ask me. Questions are my primary tool. I think a good session, 9 out of 10 things I say are going to be phrased as an open-ended question. Inductive reasoning, we mentioned that briefly earlier. Deductive says, so we're going to start here. Here's the solution, and we'll work our way back. Inductive, I'm going to try to look for patterns, look for themes in the client's life. I'm going to try to see how long has this been going? What have you tried before? What's worked? What hasn't? Let's learn from your experience and see if we can pull out a more general theme that's already present in your life experience. Disavowal of knowledge, again, I want to get to know them. I want to be a collaborator. I don't want to minimize my background and expertise. But long ago, I realized my clients can do more to improve their life without my help than I can do to change their life without their help. They know their own tendencies. They know their life history. They know their dark secrets. They know the people in their life. And I bring psychology and books and past experience with clients, but I don't really know my client until I get them to open up and share with me. So together, we're going to work to discover, to try out new strategies, to see if we can figure out a better pathway. And despite all of the Socrates, I will tell clients stories. I will share my own thoughts at times. I will tell them life lessons that have come my way based on other people that I've worked with, so that it tries to balance out and not be excessively focused on just question after question after question. There we go. Well, let me hit pause. I know, I was told trying to keep this conversational. I really wanted conversational. I'll go back into more slides at some point, but based on just sort of a brief overview, it'll stir up questions.
Yeah. I don't see any questions. I think folks are, moving on to the next slide. Some of the questions you find most helpful, I think would be great. Like how it plays out would be great, Jim.
Sure. So an important focus of my questions ends up being problem solving. I hope everyone's familiar with problem-solving therapy, originally developed by Thomas DiCirella and greatly advanced by Art Nezu, who have really done a lot of research to show it's a good freestanding treatment for depression and other problems, and they've provided guidelines and structures for it. So I try to usually keep this in mind with my clients. First of all, they need to have as positive attitude as they can while still being realistic. Family and friends may have told them everything's fine, don't worry about it, everything will work out okay. Whether we're talking about the end of a romance, the loss of a job, some other stressful events that's happened to them. And so those kinds of platitudes are really helpful. But it is important that clients have an attitude that I can get through this. that things can get better, that if I work, if I think, if I try something different, that I can make some changes in my life. And even the basic attitude of uh, problems happen. Stress is a way of life. Conflict between people is not uncommon. And ultimately, we need to figure out what we can do to deal with it. So I'll ask a lot of questions to explore, what do you see as the main problem here? If we look ahead in 3 months, 6 months, what do you hope things are like? What goal do you have for dealing with this situation? Really, what's the core problem here? How much is the problem the other person and how they're behaving? And if I have to ask a tough question, what do you bring that is part of the problem? What do you bring that maybe makes the situation a little bit worse and still instead of better? And confront that and be able to include that as part of our view. And then exploring options. What can you do to make this situation better? This is probably where I ask most questions. And it will range from what have you tried in the past? How well did it work out? What have others told you that you should try? What have you always wanted to try in dealing with this situation, but you never took that step and tried it? And sometimes I'll move them around. What would your best friend do in dealing with this situation? What would your mother, father tell you to do? Who's your favorite role model, TV celebrity, superhero? What would they do in dealing with this situation? Any of these is really central, I think, to cognitive therapy. My goal is to help them look at their situation from a different vantage point. And if they can see it from a different angle, they may see different pathways and different opportunities. Ideally, I want to, oh yeah, fire away, Adrian.
Oh, as soon as you said about the hero thing, that resonated very well with me because I kind of apply a lot of that in a lot of my therapy. I had a trauma training regarding that, and it can work with CBT and all sorts of modalities. So I just wanted to, before I forgot, just appreciated that.
Yeah, oh, absolutely. Especially these days, there's so many, action movies out there. It's really revived a strong interest in a lot of the superheroes. And
And not to cut you off, but it doesn't have to apply to heroes. It can also apply to like historical figures or people you looked up to.
yep. Well,
So,
even sometimes I'll throw out, a TV celebrity and athlete. One of my favorite is finding out who the person's favorite comedian is, because if we can bolster a little bit of a sense of humor, I mean, so many things. I'm a fan of the old Office and Seinfeld shows. They were shows about nothing, but they would take a situation and put a humor spin on it. Going to a big parking mall and can't find your car in the big parking garage. If they had done that as a drama, Seinfeld would have ended it at one season. But turning that into a comedy, and the more I've shared with clients, and even I try to finish every session with a homework assignment, something for them to do. I had one client where we talked about this, and when we finished, I said, what I want you to do this week is go through your week and look for a situation that could be annoying or it could be humorous, depending on your take. And she came back the next week and said, uh, single parent, working full time, raising two teenage boys. She came home from a bad day at work, was really stressed, walked in, her boys are there, they're acting weird. And she said, I'm going upstairs to freshen up. I'll fix dinner when I come down. And she went upstairs, went into the bathroom, was freshening up, not doing anything personal. And she heard a noise behind her. And she looked in the tub with the shower curtain pulled back, and she pulled it back. And there was her oldest son's best friend standing there, really nervous that she was going to scream at him because he's in the house. They're not supposed to have friends over. And in a flash of a second, she did her homework and said, he reminds me of Kramer. This kid is Kramer. She started laughing, broke the ice, and she wrote it down as The Single Mom, a script for a new sitcom. So a situation that normally she would have been furious, the kids would have been upset, they wouldn't have even had dinner, the whole household would have been a mess. That shift moved her into a very different vantage point. Estimated advantages and disadvantages. So once we've got ideally 10 different options, some good and some not so good, we don't want to bring in the evaluation too early or it shuts off the creativity. Then we'll go through and see which one do you think you could do, which one is most likely to be helpful, which one you're just honestly not going to do or it's going to backfire on you. And let's clean it up. And then let's figure out what are you going to do? What realistically between now and next session, what are you going to try as a way of dealing with this conflict with your boss, with your neighbor, with your spouse to see if we can make a positive effect on this situation. I'm very careful that I bring a genuine curiosity to every session. I really feel like I learn from every client that I work with, and I really am respectful that being a therapist is a real privilege, that for another person to come in as a stranger and to share with me their life story, and in many cases to share with me the secrets of their life that they have not shared with anyone. I need to be respectful of that and to listen and to learn and to collaborate and to be curious about who is this person and what can we learn to help them be a better person and to live a good, happy life. So I need to trust that the client, this comes directly from Carl Rogers, the client has a positive core and at their basic instinct is to be a good person, to move in a positive direction, and to make improvements in their life. And I believe that. I think, and at times, I have seen, I have been a therapist in a medium security prison where people have been convicted of serious crimes, but I try to view everyone as struggling to be better in some way. I want to explore, but I want to have a conversation. I want to have it back and forth. And even if clients ask me questions about my thoughts, my reactions, who I am as a person, I try to be open with that. And I will occasionally share my thoughts about life, about situations. Again, I don't want to tell them how to solve a problem. Here's what I would do, any of those things. I think but I will share with them my own thoughts at times. At the core of this, Socrates had the following view that you want the other person you're talking to only say what you really believe. And I think that cuts through a lot. That very simple dictum, just we should only say what we truly believe. And a lot of times for me as the outsider, my questions are simply, help me understand that better. Tell me more about that. Tell me why you developed this belief that you're a failure as a person, why you'll never succeed in life, why you should end your life now. I mean, help me understand this because I haven't had the same life experiences. And I want to be with you side by side to explore some of the struggles you're going through right now. I want to be able to have a whole mix of questions, and I consciously try to avoid asking a why question. I learned this years ago when my son was 2 and we had a 14-month-old neighbor over in our house, and she would fuss and struggle and just barely stand up, and he would come over and touch her, and boop, and she would fall back down on her diapered butt. She wouldn't get hurt, and she'd fuss and struggle to get up, and he'd boop, and she'd fall back down and get all upset. And I asked him, Nick, why are you constantly pushing Maggie? A why question, stupid question. Because his answer was, because I like to. So people do what they want to do. People do things because they want. You want to go on the assumption, if you ever ask, why do you do that? The person's answer very legitimately could be, because I wanted to. And it gets you nowhere. Or more often, why did this happen? Why do you have this belief? Why did this person behave this way? The most common answer you'll get is, I don't know. And then things stall out, and you have put a minor block in the rapport. You don't really understand it. The other one, avoid implied directives. I see a lot of people are doing more supervision than own frontline clinical work now. Do you think it would be helpful to talk directly to your boss, talk directly to your neighbor, to your spouse? Do you think this would be helpful? Is not a legitimate question. It's an implied directive. It's basically saying, look at me, I just solved your problem for you. Here's the solution. Why don't you go and do what I'm telling you to do? So if you at least split it into two equal alternatives, do you think this would be helpful? Or would it make the situation even worse? Now it's a legitimate question. And if you give two equally valid options, now the client can talk to you about what they think, even stretching it out to third. Do you think this would make the situation better? Do you think it would make it worse and things would fall apart? Or do you think it would just not have any impact at all? So now you're giving a multiple choice, and you're hopefully prepared to accept whichever of those three options the person gives you. Socrates used a mix of analogies to describe what he did. Socrates made it very clear he is not a teacher. He has no knowledge. He is not here to educate people, that he would go to the local marketplace and ask questions and get people talking. And he said he views himself like an electric eel, just to shock people, to shock them awake. He said, the biggest problem facing society then is a false knowledge, that you believe you know what you don't really know. And it's impossible to teach someone when they think they already know. And so his questions were more just to help people see that they lack true knowledge. And he felt he has no true knowledge. The only true knowledge that he had is that he lacks true knowledge. And so many other people have this false knowledge. I mean, we see this a lot today with the political divide in our country, and the two sides that will look at some of the same event and come with very different views about it. So it's very dangerous with our clients to get into a political discussion with them. But I think the general view that there's very little that I'm willing to say, I know. Almost everything I'm willing to say, I think or I believe. Even if we go back to, oops, did my screen just change?
It shifted, but we can still see it. Yeah.
All right, I'll try to see if I can. I don't know what happened. I lost connection with my external monitor. So we just want to appreciate that, the old view, it's been revived a little bit. The world is flat, or the sun rotates around the earth. I mean, these are beliefs people had and firmly believed. And now we look at them differently. So there's a lot of beliefs that turned out to be incorrect. Oh, I must have really screwed it up. Let me try doing that. So trying to combine the Socratic method with cognitive therapy, you know, a lot of the questions, you know, according to Beck, one of his primary question is, where's the evidence? You have this belief. You believe that others hate you. You believe that you'll never find another job, another romance. You believe that your life has been a complete waste. You know, let's look at where is the evidence. I mean, that's the core of Beckian cognitive therapy. Beck's second approach is, you know, what's another way of looking at it? You know, let's move you around. Let's, you know, I'm a big football fan, not the Browns anymore, but football in general. And, you know, there's so many times when I'll see a play and I'll say, you know, no good, he was out of bounds, or that's a good catch. And then you get the replay and it supports your initial view. And you get the camera coming from the other side and you see a different view and his foot was out of bounds or whatever. That's what I'm trying to do with my questions, is move them around. What do other people say about this situation? What will you remember about this situation in 3 months, in 3 years? Let's just try to change your view and your perspective. In Beck's 1985 book, his third question was, so what if it happens? And really, you know, the short version of that, so what? Without being rude or disrespectful, that's really a powerful question. If you drop out of college, if you lose your job, if you get divorced, so what? Is that really the end of the world? Or can you get through it? Can you deal with it? Have other people had to deal with a similar problem, and how did they get through it? So let's try to look at how you're magnifying this situation out of proportion. The other two that I've added, utility, more and more I find this very helpful. I'm not going to argue with you about, is your view right or wrong? Do you have the evidence or not? But I'm simply going to ask, is your view helpful or hurtful? If you wake up tomorrow and you believe, I'll never find romance again, I'll never find a job again, where's that going to take you? What are you going to do with your day? And if you have the view, I can get through this, I can deal with this, I can find another job, I can find another romantic partner, I can find another rental apartment, whatever, then you'll get up and you'll get moving and your behavior will be more helpful. The last one, I'm surprised about this. How long are you going to let this drag you down? You know, there have been several times when I've asked that to a client, just in casual conversation as we're talking about their negative attitudes. And they've come back the following week in the subsequent session and they've said, you know, last week you threw this at me. How long will I do this to myself? And that really stuck. And it really forced me to see, yeah, you're right. I am doing this to myself. I am telling myself that I can't do this. I can't handle it, that I'm no good. And so, you know, it's a different way of shifting their perspective through your questions. Yeah.
Yeah. So Jim, I know there's a lot of slides to kind of get through, and what I'm
happy to stop any place.
Yeah. So what I'm wondering, just to kind of maybe pull it together, you know, then we'll move into some of the case stuff, is from your experience, what helps providers improve in, like, when to ask these questions, how to move forward? I mean, one of the quotes in your book that I really like was, all good questions start with empathy and all good questions promote empathy. And that was like really helped me think about, like, how do I frame my approach? Like, from your experience, what for the providers here, when we think about like, how do we get better at this? There's a lot of cool stuff here. We're familiar with it, but what, from your training, teaching, what would help most, do you think?
Well, Carl Rogers talked about empathy, warmth, and genuineness as the three core qualities that are necessary for effective therapy. And I think they are the three that are necessary. They're not sufficient by themselves, but they're necessary. I think the most important is empathy, to be able to understand the client's subjective experience, to see the world through their eyes. And so many of my questions are, help me understand what this is like for you. And I think I've got to work from inside. I teach the graduate students. If you're an outsider looking at this client, then you're trying to fix them. And my clients are not broken. My clients are having struggles. And I'm trying to understand what their struggle is like. And I've got to do that as an insider by seeing their world. I mean, even when I've worked with clients who had a paranoid disorder, their behavior makes perfect sense. If you understand their distorted view of people and danger and threats and what they feel is happening around them, then their behavior makes perfect sense. So I've got to step in, at least 1 foot in to their subjective experience.
Gotcha.
Harry, let me ask, what time do you want me to stop so you guys can shift focus?
Well, let me check with, I really appreciate all the information here. It's very consistent with what we've talked about. So I want to honor both things, your time here, but also Gabby and the team. We're going to present a case. Do we want to move forward with a little bit more Socratic dialogue, or shift over into the case and kind of see what folks, or if other folks have questions? How do we want to move from there, guys? Do we have a preference?